And joining us now live in studio to answer your questions about heart disease is Cooley Dickinson's Dr. James Arcolio. Doctor, thank you for joining us today.
Thank you for having us.
You're welcome. So we have a couple questions for you from viewers. Our first question is a two-part. It says, I'm trying to lower my risk for heart disease. What changes in diet do you recommend, and how can I begin an exercise program?
Right. So it's a very good question. Really what we want to do is lower our saturated fat intake. And if you're diabetic, you really have to watch your sugars and your carbohydrate intake. So if you look at the things that cause coronary disease, which leads to many deaths, it's the plaque formation in the arteries that gives people heart attack and stroke. So you want to take any of the risk factors that cause that and reduce them as much as possible, which is lowering your cholesterol, lowering your blood pressure. If you have diabetes, really controlling the diabetes well. And a lot of that is lifestyle modification and risk factor modification.
And how about the exercise part of it? Someone who has not been exercising, how do they start?
Yeah, so you can go to a trainer and ask them, to give them, the patient, pointers on how to begin and what they should be doing, or you can just ask your doctor. So a lot of it is the aerobic exercise, treadmill, machines, anything that's going to increase your heart rate for a prolonged period of time. And you just have to start slow and progressively get to the guidelines.
Okay, our next question. The new cholesterol guidelines say more people should be taking statins to avoid heart disease and stroke. How do I know if I need to start taking these?
Really, you need a blood test and you need to assess your risk. So somebody's risk, if they're young, they're female, they don't have a smoking history, they don't have diabetes, their cholesterol is actually by the guidelines allowed to be a little higher. If you've already had bypass surgery or you have any stents or any documented evidence of vascular disease, it needs to be much lower because that patient already has the disease and you want to prevent further progression.
Okay, Dr. Arcolio, thank you for joining us today. And if you have a question you'd like to have answered, you can email them to us at reportit@wwlp.com. Cooley Dickinson's Dr. Hayter will be joining us on 22 News at 5:30 and 6 to answer your questions.